Hi everybody, this is Dr. Douglas Stoddard and this is the SEMI Minute, and today I wanted to talk to you about something that's really painful, and that is a frozen shoulder, the medical term for which is adhesive capsulitis. We don't know why this problem happens. Sometimes, not always, but sometimes it follows other injuries to the shoulder, such as tendon injuries, arthritis, trauma where you may have broken the shoulder or fallen upon it without a break. Sometimes it's associated with diabetes or thyroid disease, but many times it seems to just come out of the blue and we, again, just don't know why it happens. But what happens is there's a structure inside the shoulder called the capsule, which tends to get tight, very stiff and sticky. And when that happens, it does not allow the ball to move inside the socket. The shoulder is a ball and socket joint, and it becomes very restricted when you have adhesive capsulitis. It affects about 3% of the population, so it's not uncommon. Usually will hit you in the 40s to 50s, sometimes younger. In fact, I saw a 24-year-old young lady this week in my clinic with this problem, sometimes older, but as I said, normally 40 to 50 is when it strikes. In 15%, it can hit both of your shoulders, not necessarily at the same time. And at the end of a year, about 15% of people will be left with some symptoms such as pain and stiffness. Another way of saying that is 85% of people within a year of it starting are better. So if you're willing to wait a year and endure the pain and stiffness of a frozen shoulder, you can do absolutely nothing except wait. And 15% of people will be left with symptoms at the end of a year, or 85% will be resolved. Question is that what can we do for people who don't want to wait the full year? And again, sometimes this problem is so painful that people just want to do something quick and try and get it over with. Well, we have two ways of trying to treat this. The first is with therapy. Physiotherapy, chiro, massage, osteopathy, acupuncture, and any of a number of other approaches can be tried and have been tried. The problem with therapy is it usually will be somewhat challenging to make rapid progress. Otherwise, we have a procedure that we can do called a hydrodilation. This is an injection into the shoulder done under ultrasound guidance. Very accurate, very safe. We do these in the office. It literally just takes minutes. And once we inject, we then follow it with 3 weeks of very aggressive therapy. By the end of 3 weeks, about 90% of people are much better. They have much better range of motion, much less pain. Any residual symptoms after 3 weeks usually will settle down on their own without much fanfare, given enough time. But by the end of 3 weeks, most people are feeling substantially better. It is golf and tennis season, and I'm sure a lot of you are hoping to get out there and start playing. But if you've acquired shoulder pain during this past year of COVID, even though most of us haven't been as active as we like to, many people have been renovating at home, many people have been doing home yoga programs or home exercise programs, and unfortunately, you develop some shoulder pain. If your pain is not going away, or especially if it's associated with quite a lot of intensity and a lot of stiffness, you may have a frozen shoulder. If you feel you need help, come on in. We'll have a look at it, give you your options, and as I said, if it truly is a frozen shoulder, we can treat these very successfully and get you back on the road a lot quicker. Thanks for listening. I'm Dr. Douglas Stoddard, and this has been the SEMI Minute.